on Mombasa County that has decided to fire the doctors on strike, including the Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, that is Chibanzi Mwachonda. And right now, I'm having this conversation with Dr.Ochanji, who is the Vice Chair of KMPDU. And Dr. before you took a commercial break, you had mentioned some 4 counties that have decided to fire their doctors. You gave us the counties like Migori, Nyamira, Laikipia, and Kirinyaga County. Now on that list, now we bring in Mombasa County, bringing 5 into total 5 counties that have fired doctors. But kindly give us the numbers, the exact numbers of doctors who've been fired by these 5 counties.
Thank you. I mean, let's start by Laikipia, for example. Laikipia fired up to 61 doctors, and that includes specialists who have undergone intensive training. Out of these 61, they only reabsorbed 27. The rest were not reabsorbed. And we've explored all the options like we've gone to the Senate. The Public Service Commission has made a ruling. Even the court has made a ruling that these doctors be reinstated unconditionally. Up to now, Laikipia County is yet to comply. In fact, they're in contempt. That is Laikipia. If we go to Migori, for example, we have a complete lockdown where up to 20 doctors have not been allowed to access services, to access places of work. The same scenario we are now seeing being replicated in Kisumu, where the nurses have been locked out, over 400 of them. Nyamira, for example, all the doctors, more than 50, have been locked out for 5 months now. They're out of payroll, their places of work have been blocked. Now, tell me, how will devolution succeed if we're seeing this every day, day in, day out? Mombasa, for example, why I'm saying the purported sacking is illegal and unprocedural. These doctors were seconded to the county. They're not employees of the county per se. They were seconded to the county from the Public Service Commission when devolution took over. Now, when you're trying to sack someone who is a laparoscopic surgeon, who has trained for very many years, where do you think you are going to get another one? When you are going to fire an orthodontist who has trained for so many years, where do you think you are going to get other people? This trend must stop. If we are candid and we want to talk about universal health care, we want to talk about health as a right, this trend by rogue county government must come to a stop.
Right, and Dr. when I look at the total number of that figure you've given, it comes to 97. So what was the reason as to why these doctors were fired?
It's more than 97, because I've just given you 61 in Laikipia, more than 50 in Nyamira. Purported sacking in Mombasa is already 86. If you add it, is going in excess of 200. There's no reason except to term it as an attempt by a rogue county government and running away from the issues on the table and running into sideshows and high-handedness and just unlawfulness. Because why would you sack someone who is just coming to demand his salary? Why would you sack someone when they come and say that, my statutory document has not been submitted? Why would you purport to sack someone if they're going to say that, NHF has not been updated?
All right, and Dr. so from what you're telling us, these counties are going against the court order. More than 100 have been fired, and just a few, like in Laikipia County, have returned back to work. You've told us it's 27 of them who've gone back to work. Aren't the union officials looking at it as a way of the county bosses trying to weaken the unions?
That is one way of looking at it. And the other way of looking at it, and that's why we've been singing day in and day out, that we need a centralized way of managing human resources for health. Because the counties do not understand the magnitude and the importance of these healthcare workers, and the need to manage them in a proper way. When county government comes from nowhere on a single day and purport to fire 86 healthcare workers, they don't know how much has been put in terms of training this. They don't know how much the country has spent in terms of coming up with these specialists. They don't know how much the neighboring counties are missing in terms of services. our rallying call is that given whatever is trending, whatever we're seeing in Migori, in Nyamira, in Laikipia, Kirinyaga, in Mombasa, is evidence that we need a centralized way of managing human resources for health. We cannot continue doing the same thing every day and think that it will be different. It will be bad, it will be worse, and the trend will continue even into other counties. It will be unfortunate for a Kenyan who is very innocent in all this. He goes to the hospitals, just needs services, but every day they're not able to, guarantee that if I go to hospital X, I'll get services.
And it's good you're saying that you need a centralized place, centralized source to actually handle human resource issues of doctors. But are doctors, health workers in the country far from achieving that? Because when you talk about a centralized office to handle doctors, nurses, medical, in short, the health workers' issues, the health commission that has been proposed by the BBI is not the same one that, the union officials gave their presentation to the Building Bridges Initiative team.
Precisely. Anyone who loves this country and really wants to help Kenyans must come to the table and discuss a constitutional health services commission that has the mandate to employ, to pay salary, to deploy, to recruit, and to promote, and to train. The body that has been proposed in the BBI report is a mirror image of what we want and what will truly help Kenyans. We don't want just another statutory body that perhaps just for the commissioner to earn allowances, but it will not solve the problems that are bedeviling our country. If anyone loves this country, he must talk about constitutional body, constitutional health services commission, that has the mandate and the constitutional duty to handle all matters relating to human resources for health. If we have that, we will never have the high-handedness we've seen in Laikipia. We will never have problems we are experiencing right now in the other counties of our nation.
All right. Dr. Ochanji, on that note, I'd like to say asante sana for talking to us here on KTN News Center, talking to us about that firing of their members, including the Secretary General of KMPDU, Dr. Chibanzi Mwachonda, who was fired by the county government. And the county government says that the doctors failed to report to work, while the doctors are maintaining that they'll only go back to work once they receive the salaries on time and remittances are done right on time to various government bodies, including the NHIF. And so, away from that developing story, we give you more updates later on.